Welcome back to Wave 3 Listens. It's a beautiful day, and as I mentioned before, when summertime comes, that means the clothes are peeling off. You want to lose a few pounds, you want to look better, you want to feel better, more energy for this summer. Hey, you need it. We all need it, all right? And it can happen with Body Shapes Medical. Lisa Innenbach is with us. And Lisa, real quickly, you mind tackling some phone calls?
Absolutely. Let's go for it.
Because we have some here, and I want to make sure we get to them. Let's talk to Mary, who is on line 4. Mary, welcome to the show. You've got the expertise of Body Shapes Medical. Go ahead.
Hello, Lisa. My question is, for someone who may not be able to afford the Cunexa that you have just spoke about, I just wanted to know your opinion, or if you know about CLA or raspberry ketones that I've heard about, that are supposed to help reduce belly fat. If you could just kind of, give us some information on that, I'd appreciate it.
I don't know much about that, actually, Mary. You have to just be really careful with a lot of supplements that are over the counter. Studies have shown a lot of times those stuff just are kind of excreted through the body. But if you want to try something like that and that works for you, that's great. But I do know, with us and losing weight, a lot of times it is, again, the hormonal balances. You need to reset your hypothalamus to reset your metabolism. We do offer payment plans, 6 months, same as cash. I mean, the best thing to do would just be come in and see if there's some kind of payment option. But absolutely, try that first and see if that's something that might work for you.
All right. Very good information. Thank you very much. And Lisa, what we wanted to show here was some facts about hormones, and I'm going to have you voice this over, but this is some things maybe some folks are not aware of.
Right. Hormone facts, vital hormones decrease every year past the age of 30, and that can decrease up to 7% per every year past the age of 40. So at age 40, both men and women have 50% of the testosterone than they had at age 25. So again, women should not be scared of the testosterone levels and trying to increase those. That's very important for men. It's very important for women. Cardiovascular disease, studies have shown that men that are in their 20s that actually have low testosterone levels, 100% of those men had something going on cardiovascular-wise. So these are men that actually should have had normal levels, and guess what? They didn't, so something was already going on with them cardiovascular. So what does that tell us? Those levels need to be normal so that you're not getting those things as we age.
And hormone imbalance can also cause, and I was kidding about it, but it's true, memory loss, or, you can lose a little bit of memory, and I have noticed that as I've gotten older, and that's a fact, as you can see on the screen.
Right. Studies have also shown that hormones imbalance can decrease your risk of Alzheimer's disease by 20% for each 10-unit increase in testosterone. Women on estrogen are less likely to develop Alzheimer's, and the longer a patient is on hormone therapy, it lowers those risks.
All righty. Lisa, you are just a plethora of information. Let's go to line 6 and talk to Barbara here from Frankfort, Kentucky. Barbara, welcome to the show. I hope you're having a great day. Barbara, don't wait for the TV. Just talk to me. Barbara.
Did we lose Barbara?
Yes.
There. I think
Hello?
There you go. Go ahead, Barbara.
I took the synthetic hormone for years. Loved it. I felt great. I looked young and da-da-da-da-da-da-da. Then I developed breast cancer, and and it was the estrogen reactor. I would love to get started back on it again, but so with this synthetic that with this natural you're talking about, would that put me in any danger of this reoccurring?
Barbara, we would need to get you in the office and take a full health history and actually talk to your medical doctor. That's actually, a great point. The synthetic hormones have been known to increase breast cancer, increase prostate cancer for men. But, all the studies that are out there, what you did was you replaced your body with something that is not bioidentical, something that your body didn't actually, produce. So what that caused was, your hormones were, although you felt great, there was something going on in your body chemically that probably caused that breast cancer. So if you come on in, let's get a health history, let's talk to the doctor. It's not just me. Again, we work as a team with a compound pharmacist, with a physician, with our nurses. We all look at everything. But I do think bioidentical hormone replacement would be something great for you.
All right. Barbara, thank you for your call. We're going to try to grab 2 more real quickly and talk to Connie here in Louisville. Connie, welcome to the show.
Hi. I have a question. I have rheumatoid arthritis, and I also had back surgery done last year, and I was wondering, it's really hard for me to exercise because I have it basically in every joint, both shoulders, hands, wrists, knees, feet, and now I have a back problem. do need to exercise, and I'm wondering if the HCG diet would work for me.
Absolutely, Connie. As a matter of fact, during the HCG phase, you don't actually exercise. And once we get the weight off you, that's probably going to help with the rheumatoid arthritis. And then if we could get your hormones checked, I know this just sounds like a miracle for everything, but studies have actually shown, too, that can decrease your symptoms of rheumatoid arthritis. So, again, we would probably first get you started on the HCG, get some of the weight off, relieve some of that pressure on the joints, and then take a look at your hormones and try to get those in balance.
All right. I think we have time for one more. We're going to go to Lana in Cloverport, Kentucky. Lana, welcome. You have Lisa.
Hello?
Yes, go ahead.
Yes, I've got a question. Exactly. Well, I've been watching this. I had a complete hysterectomy. Of course, my hormones are gone and everything. And I wondered about my sexuality, about increasing my sexual desire. Would this help with this too?
Oh, absolutely. Probably you, what is your age, if you don't mind me asking?
54.
Okay. More than likely your testosterone levels are really, really low, so that would be the first step, again, to look at all of your lab work. But, a lot of places out there will tell you, oh, if you've had a hysterectomy, you don't need progesterone. In fact, women do need progesterone even if they've had a hysterectomy. So we would look at all of those levels. And I would like to point out, too, hormones, estrogen, progesterone, and testosterone are the three main ones, but we can look at everything. So you would need to come in, let's get a full health history, get some blood work, and we can definitely help you out with that.
Once again, Lisa Innenbach, thank you so much. Body Shapes Medical.